We've done remarkable work for our pediatric patients. Mortality is way down with penicillin prophylaxis and immunizations. We know that there have been marked improvements in terms of preventing long-term complications. But what we all see is, as a lifespan provider, I see it in my adult patients as they go through that transition of what to do, how to do, all those sorts of things. We realize that unless they're fully knowledgeable, or at least they have some kind of idea as to what can happen as adults in terms of their long-term care, they often don't have a really good understanding as to what they need to do, and often they fail to show up for their visits. They don't come to their appointments. They're often in the emergency care areas and frequently admitted because they just don't have the support they need to make sure, or the education they need to make sure that they do a transition well. So we know that the transition between pediatric patients to adult patients has been very challenging. And we know that even though we've done a lot to reduce the risk of death in pediatric patients, the risk of death in adolescents and young adults continues to go up, and actually is one of the most important times to make sure that patients are addressing the issues of medication adherence, to following what the plan of care is for their physician, and to make sure that they understand the risks of their disease, what their complications could be, and more importantly, that they continue to follow with their physician, even though they may not want to, and all the issues that go along with being an adolescent in terms of wanting to be independent, wanting to make their own decisions, and really trying to be an adult. A lot of times some patients don't have the parental support that they should, that they don't have the encouragement of others, that they don't have the support system that they often need to get through that difficult transition from pediatric care to adult care. So what we encourage is to make sure that pediatric patients, as they go through that adolescent period, understand what type of sickle cell disease they have, what medications they're on, what they need to do for acute visits, and what they need to understand about long-term complications of their disease as well, so that they can make informed choices about what care they want, what care they don't want, and then what could eventually happen if they choose not to do specific care.